has, Mr Chair.
The Honourable
Mr Chair.
Paula Bennett.
Mr Chairman, I thought it was opportune to answer a few of the questions that have come up over the last few calls that have been. First of all, to the Greens, who had, quite rightly, I think, some concerns around sanctions and whether or not they would affect a complete sanction for those particular children. And the answer is we're inserting the new section 177, which says that there can only be a 50% sanction for those that have children. I actually introduced it through the Future Focus in 2010 for that very reason, where we had some concerns. Also some concerns around sections, and they're not something that one does lightly and without taking into consideration the actual consequences of them, because I do kind of agree that no one's sitting there thinking that this is a life of luxury, particularly living on the DPB and trying to make ends meet. So to actually look at how you incentivise and how you make sure you've got the right kind of obligations, I can tell you leads to a lot of debate in my office with very good officials and amongst my Cabinet colleagues as well, as to how you try and get that balance right. I would say that the incentives that we're putting in this bill for those that are going into education, that those that are doing the budgeting, that was an interesting discussion as to, instead of actually sanctioning the behaviours, and actually, not actually getting the kinds of behaviours you want. We wanted to look at, instead of rewarding the kind of things that could happen, and by giving a bit more money in people's pockets, there's a really good chance people would get $30 more. We sanction now, and I think that's important to know, and actually we sanction quite a lot. For example, in the month of May, there were about 3,500 sanctions. Of them, about 3,000 were to those on the unemployment benefit. And these may be part sanctions, by the way, so they're not all 100%. Some of them are for 50% and some are more. It's quite high, I obviously keep a close eye on the numbers, and I'm quite surprised at times at sort of how high they are. About 3,000 are unemployment benefit, and I really am going from memory on this, but about 312 are from sickness and other, and then we have about 170 from memory, which are on DPB. Then what we've done, and this was actually a big call, particularly from Dr. Peter Sharples when we were doing Future Focus, was he wanted to make sure that we were following up on those who had been sanctioned. So they were not staying, particularly those with children, a long time on 50%, and there was a risk of that, particularly from their perspective, from the Māori Party's perspective of those that are isolated and living in very rural areas, that, would they just be sanctioned at 50% because they didn't turn up to appointments, which they perhaps for good reason hadn't turned up to beyond their means, and then sitting for months potentially on 50%. So we've put checks and balances in place to make sure that we're following up with them immediately, that actually recomplying is relatively easy and you can literally kind of do it within a day. Because I know it sounds by its very means that sanctions are there to punish, but they're not. They're actually there to make sure that people are fulfilling their obligations, and we want to make sure that recompliance is actually relatively easy and that people can. In most cases they do. I also wanted to sort of jump to some of the cost things that we've been talking about, and we certainly have had some discussions on the forecasts of Treasury and the forecasts of MSD. Let me give you an example of a forecast which, bless Treasury's cotton socks, who are not here so I can say it, were just fundamentally wrong. So with Future Focus, the savings that were projected out of that, which were relatively minor changes, were perceived to be $13.3 million in the first year. Actually, the savings were $29.9 million. So we more than doubled them. Yeah, they are, by their very nature, our officials in Treasury, conservative and very narrow as to what they will look at as far as the changes that are happening, and with good reason, that's their job to be. But they will not look at behavioural changes that come from these. So I am very confident that when you even take the example of previous sort of changes under Future Focus, what can happen. I suppose I spend my last minute saying we are targeting. And that is a fundamental difference of what you see in many of the programs that are out there now. And I can accept that there are members in this House and there are members out there in the public that don't agree with targeting. I do. At the moment, we scatter across that whole 188,000 people, and we hope we get to the ones that need it most. We lightly touch instead of going into the intensive support and wraparound that some need. Actually, the reality is most of our kids are going to be fine. They've got us for all of our intellectual or not grunt that we bring with it, our love and care, our sort of attention over our extended whānau, everything else that comes with it. It is the other kids out there that haven't had that greater start in life, that have struggled all the way through, that through often circumstances not of their own doing, and we need to wrap the support around them. I pick up one thing that Mr. Prasad said, and he sort of said, and I've written this down as best I can, he said, when guided and trusted, these young people will succeed and move ahead. I could not agree more. IIB, Mr. Chair. The IYB, by its very nature, means these kids have not got someone to guide them. They are on the independent youth benefit because there is no one there to look out for them and care for them and support them. And they actually have to prove that to get on it, yeah? It's not easy, it goes through, and so what we are trying to do is give them that person connected to them in their community who will guide them, who will trust them and have a mutual responsibility with them. And I agree you can't actually replace a parent or a whānau member, but the sad reality of in some of these young people's cases is that we kind of have to try to. Yeah? You cannot actually replace a family member or where that love comes from. But the reality is, unfortunately, for some of the kids who see in child death and family, and for some of these young people, we're going to actually have to try and replace that by putting it into a community person, and that's what we're trying to do. You know, you said they need to be taken carefully by the hand, and I could not agree with you more. They do need to be taken carefully by the hand, and it is by us actually taking them. Well, it's just kind of the words you used, and I found it quite interesting that by their very definition, these are the young people that need us most. So we are going to target them. We could lightly scatter across and hope that we get those that need it most, or we can do these risk assessments that mean we are narrowing in on and supporting and, yes, wrapping around all of those that really do need it. I want to sort of also mention teen parents here, which are being discussed tonight, not very much, to be quite fair. And they are young people who, as I say, in 2010, there were about 4,600 teen births, and we saw that go down by about 600 last year, actually, which was sort of a fantastic thing, but let's see how we sort of go from there. You know, you have around 5,000 teens at any one time of that 16, 17, 18 years old who are needing our help. What we do at the moment is give them anywhere between $300 and $600 a week into their bank accounts, and then off they go, and we hope that they're all right. And that is wrong. It is fundamentally wrong. And you can ask why we're targeting and why we're wrapping around so much support and why we're doing this differently. We're doing it because they are young. And actually they do need our support and they do need more guidance. And we will work them towards independence. Some will only take 6 months, some will take 2 years. Whatever it takes, we will work with them. We actually did look at those that are 18 and 17 and turning 18 very quickly. For those on teen parent, what we did was we extended it, they could go into 6 months. We looked at those teen parents who are actually in a relationship, so not receiving benefit, but should they still be open to getting that kind of support from within their community and from an organisation, and we opened that up to them so that they can have access to that level of childcare, that level of support that they need so desperately. Some are calling this punitive. I've already heard someone tonight say it's beneficiary bashing. It is anything but, you know. And if every time, particularly I suppose a national woman stands up and mentions that they want to work with these people and actually wrap more support and see a different future, we are knocked down and told that we must have some sinister ulterior motive. Well, that is simply not true. But will we cajole, will we push, will we obligate, will we incentivise, will we put it all right? Yes, we will. And that is the premise behind this, and as right as we can get it. We will trust in those organisations, put our responsibility in them to make sure, as we check all the way through, that these young people are given every shot to get ahead and make a real difference and play their contribution as well.
I call Saul Williams to open.
Mr. Chairman,